Here at ASCO 2015, I'm Thomas Baldrick for Oncology TV. This is Dr. Matthew Taylor from the Oregon Health and Science University. Thanks for stopping by, sir.
Thanks for having me.
So let's talk about this work you're doing with Dr. Kate Newbold with Lenvatinib on its efficacy and safety. What can you tell us about this study?
Sure. So this was a planned subgroup analysis based on the SELECT clinical trial. This was a large phase 3 clinical trial with a drug called Lenvatinib, which is an oral multikinase inhibitor, and this was specifically for patients with metastatic differentiated thyroid cancer.
And how did you go about doing this? What were the methods?
So this was an international clinical trial that was done across many different sites. And so patients were eligible to participate in the trial if they had metastatic radioactive iodine refractory thyroid cancer. Patients were randomized either to get placebo or the actual study drug Lenvatinib, 2-to-1 randomization, Lenvatinib versus placebo. And so the clinical trial basically demonstrated some very impressive clinical efficacy with the drug, showing a large percentage of patients having a very good response to the medication, and an improvement in progression-free survival.
What stands out most to you in the data?
I guess what stands out is how quickly the patients responded, how quickly the tumors decreased in size, and the magnitude of the response. So about 65% of patients had at least a partial response. So a substantial number of the patients responding very well, and the duration of the response was impressive as well, around 18 months.
So how do you build upon this? Where do you go next?
I think the field is moving in the direction of combination therapies with targeted therapeutics plus immunotherapeutics. So I think that's really what we're going to see. This abstract in particular that we presented with Dr. Newbold was focusing on the different groups of patients that had previously been treated with an anti-VEGF drug and those who had not been treated. And so what this abstract in particular focused on was the fact that whether patients were previously treated with an anti-VEGF therapy or not, just came right into the clinical trial and were treated with Lenvatinib, the response rate and the progression-free survival were similar in both groups.
Very good. Thank you, Dr. Taylor. We appreciate it.
Thanks for the time.
Nicely done, sir.
Thank you.